Thanks for coming along, everybody. Some of you may have already been in the previous one, which was focused on canine atopic dermatitis and itching and inflammation. This is more looking at where the new supplement, which some of you may have heard about already, which is PEA, nothing to do with a vegetable. It is a natural substance that's produced within the body. This is one of the great benefits of this supplement, as well as its clinical benefits, which is being proven in dozens and dozens of clinical trials, which I'll come on to. So palmitoyl ethylenamide is actually a fatty acid amide produced by cell membranes within the body in a wide range of organs, tissues, and cells. And its primary function is to regulate inflammation and pain within the body. So it's a natural anti-inflammatory and it's a natural analgesic, and it's designed to keep the body comfortable during times of stress and damage. So what triggers the release of PEA is cellular damage, inflammation, pain, and also stressful events of various kinds. It's produced on demand. So the body has the capability to manufacture this in response to certain events which affect the internal status of the body. Now, we're looking at musculoskeletal problems and the inflammation that arises, which is associated with osteoarthritis, spondylitis, and also muscular conditions. In people, it's been shown to significantly reduce pain in humans with fibromyalgia, for example, as well as neurological pain and discomfort associated with the back, with the TMJs. And so it has wide-ranging health benefits, which can be hugely beneficial for dogs. It was discovered well over 70 years ago during the 1950s, but has recently gained a lot of interest following research over the last kind of 10 or 20 years. It's also found naturally in certain foods, such as soy lecithin, soybeans, egg yolk, peanuts, and alfalfa. Dietary sources aren't very helpful, unfortunately, because they're not very water soluble and they're not really present in high enough quantities to exert a positive effect internally within the body. Think about it, because it's natural, as well as being clinically effective in these trials that we'll come on to, it's also extremely safe, because what you're doing is giving the body more of what it's already capable of producing, but isn't producing in sufficient quantities to create the beneficial effects that we're looking for. So in a recent study of 661 people who were supplemented with PEA, for example, for pain, were no single side effects that I can recall. In the animals that we've dealt with so far, there's been a slight softening of stools in the odd animal, but nothing else. Another big advantage of this, for as far as we're concerned, is that it's not only able to help dogs, but cats and also horses. We've covered the skin side of things in the previous webinar that we've just done. So it's brilliant for canine atopic dermatitis, for example, but it's also shown a lot of promise with protecting brain function as pets get older, cognitive function. It's neuroprotective, as well as having a beneficial effect on stabilizing the immune system. In various other clinical trials, predominantly in mice at the moment, but this will extend to other species as time goes by, it's been shown to stabilize mast cell function. Now, as mast cells are involved in the allergic response and also many other inflammatory processes throughout the body, and this helps to downregulate mast cell sensitivity and release of histamine. So other positive benefits in other areas. But where does this fit in with regards to joints? Because we provide a joint supplement, joints, and also a joint remedy. Now, we would generally advise those to begin with as pets get to the stage where they're either experiencing some form of stiffness or reduction in activity, or even before, because most dogs have got signs of degenerative joint disease within the joints that isn't immediately apparent from around about the age of 6 onwards. So you can actually start to give it prophylactically at that age to preserve joint function and joint health before you see any observable signs that their mobility and their skeleton is being affected. Also, at the other end of the spectrum, I'll just pop this in the first kind of 12 months of life to make sure that you're getting optimum growth and development, particularly in large boned dogs. And that can be continued to 2 or 3 in the giant breeds. So if you've got a Labrador, for example, supplementing till around about 18 months is a good idea. If you've got something like a Wolfhound or a Bernese Mountain Dog, up to at the age of 3, it's good to continue with the joints. Quickly, many of you will know this already, but the reason joints is so effective, more effective than anything else out there, and I'm not just saying that, this is feedback that we get on a repeated basis, is that glucosamine, chondroitin, and green-lipped muscle-based products largely support cartilage health only, whereas joints provides the nutritional building blocks for every part of the musculoskeletal system. So you've not only got cartilage, you've got the synovial fluid, the joint lubricating oil, you've got the muscles, tendons, ligaments, bones, and the fibrous supporting tissues, and then you've got structures like the little bursts, the fluid-filled cushions that ligaments and tendons sit on to prevent inflammation developing. So really important that joints is so effective that in the early stages, very often as a prophylactic or when stiffness first starts, then joints and the joint support remedy, which assists the body's natural self-repair and regenerative processes. So this is the part of the body that takes the building blocks and uses them to repair damaged joint tissues or to maintain joint health. The two work really well together. Now, inevitably, at some point during many dogs' lives, if you get joint pathology progressing, which it often does, then you need additional support in terms of pain relief. And this is where PEA comes in. Supplementing with PEA on top of joints and joint support provides another significant layer of support. Now, we became really interested in this when we came across clinical studies, one which I'll mention at this stage. It was a trial done in 4 show jumping horses. Now, these horses had been unresponsive to treatment with physical therapy and also with non-steroidal anti-inflammatories. They were then supplemented with PEA, and within 4 months, all 4 horses were back competing without a reoccurrence of the inflammation that was present. I think one had navicular disease and the others had some other condition. Now, that is massive for us, and it's massive for pet parents because it gives another natural way of influencing the body's self-healing processes without having to resort to steroids or something like LIBRELA. It's also been shown to be extremely beneficial for pain of every kind, including osteoarthritis. So you've got encouraging joint building with the joints. You've got helping the body to repair damaged joint tissues with the remedy, the joint support plus recuperation remedy, and now you've got natural pain relief to complete the circle. It's also been shown to help with a wide range of musculoskeletal conditions unrelated to arthritis. So if you've got a dog, for example, that has spondylitis or problems with the articulations within the joints, it can help with discomfort too. Why supplement with PEA? This is something we're asked for. Well, if the body can produce its own PEA, why do you need to give it in the form of a supplement? And what happens to it when you've got any chronic process occurring within the body, whether it's inflammation or pain? PEA is used up quicker than the body can produce it. So the body can't meet the demand for the analgesic and anti-inflammatory effects that's required because the process is chronic. And this is where adding it in the form of a supplement to the diet and increasing the absorption of that enables it to create a positive health benefit. So what we suggest is adding it in and then keeping a record. It's always important to monitor because you want to be absolutely sure that whenever you use a supplement, this is actually helping or not. And unless you actively do that on a week-by-week basis, it's easy at the end of, say, 12 weeks to think, I'm not really sure whether it's helped, or it's human nature. We forget how bad things were before. So we've produced a little card which actually goes out with every tub of PEA. I'll just hold it up there. Week 0, you actually score the stiffness out of scale of 10, going from severe, which is 10, right down to 0. There's a few kind of pointers in between. So you're looking at stiffness, pain, activity levels, reluctance to exercise, and all that kind of thing. And you just give it a score by colouring in one of these circles. And then you would colour a circle in week by week for 12 weeks, so that if you're getting a positive response to the P, then you will actually see the stiffness score coming down. And because the inverse of that is improvement in quality of life. We've got a lady, I don't know whether Kathy's on the call at the moment, but Kathy's got a Bernese Mountain Dog who's getting on in years and had a lot of health problems about 12 months ago, came to us, was on another joint supplement and changed over to the joints and the joint spot and did really well. Big dog, getting older, started to slip back over the last kind of month or two. So we suggested adding in P, I think it was around about 4 to 6 weeks ago, 8 weeks ago, something like that, and had an email from Kathy several days ago saying that Teddy was doing zoomies again and wanting to walk further in the field. Now, Teddy's not the only one. We've had several other doggies, particularly large doggies, actually, two of them German Shepherds, that have done significantly better once P was introduced towards the end stages of stiffness and arthritis progressing and developing. So this is a really exciting product for pet parents to be able to have access to when needed. And we still suggest a layered approach. Obviously, you can give everything all at once as soon as you like, but we tend to say joint and the remedy, and then the P is there in reserve for if and when needed. Micronization, you'll see that on the front of the label. This is how the product looks. An important part of supplementation and the production of this kind of natural supplement, particularly to do with P, is a process called micronization, where the particle size is gradually reduced by a mechanical process which boosts bioavailability and absorption without affecting the chemical structure, which is responsible for the physiological effects and the health benefits that arises from supplementation. And you probably remember earlier on I mentioned there are food sources, but one of the reasons why they don't radically influence stiffness and joint problems or any of the other health benefits in any real sense is because they're poorly absorbed from the diet and poorly water soluble. And so that is important. The other aspect that we'd just like to point out at this stage is that, as with all our products, there is nothing else in this other than pure P, palmitoyl ethanol amide. We don't use glues, binders, fillers, or chemical additives of any kind. Purity is absolutely utmost with regards to everything we produce, and particularly with the P. So that's exciting. It's also been shown to help with osteoarthritis in dogs as well. With the clinical trial that we think is most impressive is the show jumping horses, because they were unresponsive to other forms of treatment as well, and yet the P was able to get them back doing what they. It's a single product. There's a dual pack and a triple pack which work out cheaper. There's also a bundle with the joints supplement and also with the remedy. So that's an overview of where P fits in, why we're excited about it. I'll just add at this point that it has lots of other health benefits outside of the skin and outside of the joint supporting properties. Cognitive function, it's neuroprotective, so nerve function as well, and pain. These are all really important areas for quality of life. So that's 20 minutes. I'd like to open up the floor to any pertinent questions. Heather.
Thank you. Hi, Vince. As we've got all our dogs on your supplements with amazing results. We've got Bear, who's 74 kilos and intermittently lame. Is it something, he's already on the joints, is it something that you take long term? If he were to go on it and we see improvements, do we keep him on it?
Yes.
Yeah. So it's not like a pain relief. It's not like an analgesia. It's a sort of repairing type.
I personally would, for two reasons. One, if you're getting a positive response, with it being natural and being a supplement, then I would continue.
And it's working. Yeah.
But also because there are these additional health benefits to do with preserving cognitive function and brain function and the health of nerves and the healthy skin. And there's going to be lots more positive health benefits coming to light, because although it's been around for over 70 years, the level of research has only increased dramatically over the last 10, 20 years, which is not very long in terms of a natural product. So I personally would carry on, but you'd be quite within your rights, and it would be interesting to know whether withdrawing it, the benefits would continue or not. I would just point out, I'm glad you asked the question because you reminded me that although we're focusing on pain management at the moment, the horses went back to compete without reoccurrence. So it must have an anti-inflammatory effect as well. You can help any animal that's lame use the leg more effectively, but they don't go back to full function without reoccurrence, without there being some anti-inflammatory effect as well. And of course, we know P has that within the body. So it's entirely up to you whether you would carry on or not. The curious side of me would probably try without, if I were in your position, just to see whether it was needed from a musculoskeletal point of view. And then I'd probably add it back in for the other health benefits.
Yeah, thank you. I think I need it.
Yes, and we're taking it. We're trying everything.
Thank you. Thanks, Vince.
Brilliant. Thanks, Heather. Anybody else with any questions?
Sorry, Vince. You think I never use video conferencing? I just wanted to check, because Ruby's got hemangiosarcoma, would it be okay to give her this?
Yes.
It would be. Okay. It's just to make sure that, because obviously she's not, we don't think she's in pain, but we think that it might, if it would give her a bit of help. She's doing really well on what she's got at the moment, but if it could give her a bit of help, that would be great. And then Rufus, he's on the joints and both the supplement and the remedy. He still gets, when he gets up after lying down for a while, having a big sleep, he is obviously a little bit slow and a little bit sore. So I'm taking it that he's now of the age that this would really help him.
It's certainly worth trying. Yeah, absolutely. Because the body's producing this substance naturally to provide analgesia and to keep inflammation under control. Of course, inflammation is a natural protective mechanism. The reason inflammation is there is part of the body's natural repair processes. You get something that's damaged and all the white blood cells come in and the blood vessels dilate and all the rest of it. If healing is complete, then all that shuts down again once whatever needs help and support and repairing has been dealt with. But when you get chronic inflammation, chronic pain, the body isn't able to sustain P production to a level which is keeping that under control. And of course, the reason why I said yes straight away is because the body's producing P naturally. It's a natural part of the body's physiology and makeup. So you're not putting something in, for example, when there's other conditions present like cancer, which is potentially going to interfere with medication or do something untoward that you wouldn't want happening with regards to the immune system function and everything else. So it's a great question, really important question. So I don't see any reason why you wouldn't supplement at this stage.
Okay, great. Thanks, Vince.
Brilliant. Thanks very much. Right.
Hi, Vince.
Hi, Sarah.
Hi. I was messaging you last night on Facebook. I've got an 8-year-old Westie. She's been diagnosed with spondylosis. Now, she had to come off the Inflicam because her liver enzymes are. So I was wondering if I was to get the combined package, which is the joints, the remedy, and the P. Do you think she'd be able to come off the paracetamol? Because obviously paracetamol is not going to be helping her liver enzymes either, is it?
No, what we recommend, and we've got links from the product page to some of us, we did this with the people who have dogs, for example, with canine atopic dermatitis that are on medication. So they're on Apoquel and these kind of things. We've laid out a step-by-step process for testing to see whether medication is still required or whether a lower dose can be given rather than the full dose. And it involves, first of all, supplementing for 12 weeks before you do anything. And always do it in consultation with a vet. That's really important because you can't reduce medication too quickly. Otherwise, the body can go cold turkey or whatever inflammatory process is under control could flare up, become really uncomfortable and difficult to deal with. So the first thing I would say is similar to the withdrawal of Apoquel for dogs that have got chronically itchy skins as a result of atopy. In these kind of scenario, we would say, look, supplement for 12 weeks to begin with. Speak to your vet and say, look, can we cut down the dose of medication by, say, 20-25%? Keep your vet in the loop. Now, if the supplements are working effectively, you may see no deterioration in mobility and movement and play and activity. If you don't see any adverse effect when you reduce the dose of medication by 20-25% after, say, 2-3 weeks, then say, can we notch it down further? So you're literally coming down a ladder. You can 20%, everything's hunky-dory, come down another 20%, wait another 2 or 3 weeks, reduce it down. And some pets will be able to come off medication completely. We have lots of people who have been given anti-inflammatory drugs for joints, and over the course of a month or so, or 6 weeks of the supplements, they've been able to come off it altogether, and they've not needed the anti-inflammatories because the body is building better quality joints, and you're supporting the body's ability to repair itself. And that removes pain, not because it's a painkiller, but because the tissues are no longer creating inflammation when they move. So it's a step-by-step process. And that's what we would advise in this kind of scenario. The other thing I would say is we've got some links on this, on how to do this for joints as well. What I would say is that in addition to the 3 supplements, the best bodywork therapy that we've found in these kind of situations is McTimoney chiropractics. 2 or 3 sessions of that can be really helpful on top of the supplementation. So with the joints and the recuperation and the PEA, you're helping the body to create the healthiest possible joints, bring down pain and inflammation as much as possible naturally by working with those pathways within the body. But that doesn't correct skeletal misalignments, which occur in nearly every arthritic dog, whether it's hip dysplasia, whether it's osteochondritis, or whether it's spondylosis. If there's pain in any part of the body, changes shape. There's a natural compensation. The body leans one way or another as it tries to find a more comfortable posture. Now that creates knots within muscle, knots of tension. It creates stretching of some ligaments and compression of other ligaments. The bones down the vertebra, down the spine, can be slightly misarticulated. Now, McTimoney is really gentle. It's akin to balancing a 10p piece on the surface of the skin. That's the amount of pressure that's applied. So it's using the body's natural ability to self-correct. But a skilled practitioner, during a session, can bring about realignments of all these skeletal structures. That releases a lot of pain and tension. On one side, you're doing everything proactively as a pet parent to help the body nourish itself and provide analgesia and better quality musculoskeletal structures. But by bringing in a McTimoney chiropractic therapist, all these misalignments correcting help to produce easier movement and release a significant amount of pain. And it's a good analogy. I think it's like balancing a wheel. If you don't have balance of wheels on your car and they're even slightly off, you'll get abnormal whirring on the inside. If the 2 wheels aren't aligned, the car will be juddery or driving forward. It's exactly the same with the skeleton in a dog. Get the conformation in the right alignment. Release the pain that's being held in muscles and fascia and ligament. Supplement, and really you're getting complete care. And the only thing after that, which was I specialized in orthopedics for 3 years. I love talking about, I could talk all day about bones and muscles and all the rest of it. But once everything is in alignment, that's when physiotherapy and hydrotherapy can be helpful in strengthening the body's tissues. When it's in alignment, the skeleton is completely lined up and functioning the way it should. A supplementation, then you look at exercise-based therapies once everything is in the right place, because the idea of that is you strengthen the muscles and ligaments in the right position so it stays in the right position and things don't start to pop out of alignment.
Very much.
You let us know how you get on. Anybody listening who needs any help when they started with the supplements, do get in touch. We tried to lay out as much as possible on the blog page and on the product page the different options and how to proceed to get the best results.
Thank you.
You're welcome. Hello, Christine.
Hello. Don't quite know why you can't see me. I don't know what I've done, but never mind. Obviously, I've been using your joint supplements for many years with my Goldens. One of the boys got to nearly 16 with it, which was fantastic. And his daughter has recently died, almost 14. I've also been taking the joint supplement myself for quite a while with osteoarthritis in my hips. Would the PEA help me as well?
According to the trial, this 661 humans, virtually every person, as far as I can remember, experienced significant reduction in pain and inflammation after taking the PEA. I would say an unequivocal yes, definitely. Yeah.
Brilliant.
The joint works up to a point. I mean, we've got a gentleman who started to take it because of his doggy, the improvements he'd seen, who couldn't close his hands. He could get so far. And within 6 months of taking the joint supplement, he's able to do this. But I'm pretty sure at some point down the line, stiffness starts to return, or that any discomfort appears, then that will be the time to introduce the PEA as well. It also helps with cognitive function and, and recall.
Yes, I think I could do with that.
Me too.
Oh, well, thank you. Yes, all of your supplements are absolutely brilliant. And I'm very lucky to have Goldens that have reached very good ages. Thank you very much. Keep it up.
It's a pleasure. And do let us know how you get on.
I will do. Okay, thanks, Vince.
Take care, Christine.
Yeah, bye.
Bye. Justine, you not got a question?
Okay then. No, all I did write in the comments.
I saw that. Yeah, I saw it flash by. Yes.
Yeah, that with Simba, we had him on joints for a while, and he's 11 now, and even the last year has deteriorated a bit. Put him on PEA, like you suggested, and he seemed to improve. And then, like you said, after a while, you think, oh, is it doing any good? So we took him off it for a little bit. Saw that he declined again, put him back on it. So you think, yeah, he is doing good. And then when I told you about his increased weight, we then upped the PEA, the amount that we were given, and he was significantly better. And yeah, he has been on a really strict diet and he has lost weight, which again has really helped with him. So that strain when you see him trying to get up and leading with his head, trying to pull his body up. So yeah, it's all really good. And it's interesting you said about it helping with fibromyalgia. So I'm going to be dipping into his supply now to see if it helps with, because I've got myofascial pain syndrome, fibromyalgia and chronic pain. So I'm going to be like trying it for myself. And yeah, I'm quite excited about that.
I'm glad you said that, because if anybody tries it for themselves as well as for their pets, do give us feedback, because a lot of what we do is based on direct feedback. Clinical studies are great, but it was only the response in the animals that we deal with that pricked our interest in this in the first place. And so it's invaluable to hear from pet parents about their experiences, not only with their animals, but also with themselves. So do let us know if anybody does try it for themselves, what they experience, because that's it. As I say, it's not only interesting, it's really helpful with regards to sharing with other people. And following on from that, Justin mentioned about stopping it to see and then starting it again. We're a great believer in this with supplements as well. The benefit of a supplement is the proof of the pudding, isn't it? And why the supplements have ended up as effective as they are is because we've had to adjust the formulations and balances over the last 40 years. We started about 20 years ago, but the foundation for this was laid 40 years ago to make sure that it was as effective as possible. And you only had to stop a supplement or lower the dose for a week or two, and you'll soon know whether there's a deterioration in quality of life or not. And there's no better way of affirming, wow, this is really good for my pet and I'm going to carry on with it, which I think it's a good thing to do on occasion, to just remind yourself just how powerful these are. And it's one of the things that we say when people say, why give supplements? If a dog's getting a meat diet or a processed diet and everything's in it, then it doesn't need any supplements. But the quick and easy answer to that is, just give a supplement for a month and you'll soon know. So if you add vitality to the diet, 90% of pet parents will say the ears, like the skin is healthier, the coat's better, the eyes are clearer, there's more energy. If the diet is providing everything a dog needs, you won't see anything because it's already getting all those nutrients in the diet. So the proof of the pudding is always in the eating. If you're not sure, just stop something for a little while and you'll soon see whether it's actually helpful or not. Justine?
Yeah, I was just going to say, when I went on the last Zoom you did about joints and pain, you mentioned a supplement which was an algae supplement.
The algal oil.
Yeah, and when you said about coat and skin then, that made a noticeable difference to him. The only thing is with him, I have to break the capsule and just give him half because it has an effect on his emotions. Yeah. He's got colitis anyway, so the fats and stuff do tend to trigger him a bit. But half a dose is fine. But yeah, his coat really changed, and I just think he felt better. So it was great. Yeah, thank you.
Yeah, what Justine is talking about there is algal oil. We recommend one from Time Health. We have a code that you can get 15% off. And the reason we recommend algal oil as opposed to fish oil is that most fish oil is contaminated now with chemicals from the ocean, so polluted. So you've got heavy metals, you've got forever chemicals, you've got pesticide residues. So algal oil is actually produced in vats away from the ocean. So it's pure, and it's a highly concentrated source of omega-3 fatty acids, which is important for skin health, for the immune system function, and for hair quality as well. It's a much, much better supplement than any of the fish products out there. And Heather, you're distracting me now. I'm a sucker for any Pooch's face. Hello, gorgeous. Oh, isn't that lovely? Who's that?
This is Mr. He's, I don't think you remember Billy. Billy was a massive, looked exactly the same, and he's our latest rescue. Yeah. He's liking your voice. That's what it is.
But you know, if I were there, I'd never get any work done.
Well, this boy was really growly and scared of everything. Yeah, it's a long story, but he's so sweet.
Oh, look at that face. Isn't he lovely?
Oh, yeah, I know.
Brilliant. Right, Karen.
Let's take it down.
Hi.
Hi.
I wondered if you could, in terms of being it possibly neuroprotective, I've got a dog who's, as a result of his osteoarthritis, has had nerve impingement, and he's become more and more, increasingly more unstable on his hind limbs. But he has gone on to develop other neurological issues. But he's been off LIBRELA for a year now, but he didn't do well on it because of the aforementioned probable neurological conditions that weren't ID'd to start with. I'm wondering, I'm going to give the PEA a go anyway, but do you think, is it possible we could see some improvement with his neurological issues going on?
The answer is I don't know, but what I do know is that in the research, and of course, we're only covering joints and skin to begin with, although there's this huge other area, but there is definite evidence that it is neuroprotective, and it delays cognitive function decline and related conditions within the brains of pets as they get older. So I know it has that capability, and I would certainly give it a try in these circumstances. And as I say, do let us know if you notice any improvements in that respect.
Yeah.
And it is produced within the brain. So obviously, the fact that it's produced within the central nervous system, it must be exerting a anti-inflammatory effect within that particular part of the body. Yeah.
Okay. Thank you.
Thanks for the question. Really good question. Go on. Rosemary's just put a hand up.
Yes, sorry. One last thing that sprung to mind there with the last question. Eddie's hydrotherapist's own elderly dog has had a stroke, and I know she has a tilted head from it. Should I be recommending it to her?
I would. If it's having a positive effect on the nervous system, anything which supports tissue regeneration and repair within the central nervous system is worth giving. I would also add in organic coconut oil, because it's a readily available source of extra energy to the brain. So once it goes into the body, it's broken down into ketones, which cross the blood-brain barrier and nourish the central nervous system. And there's been lots of studies which have shown that it improves cognitive function and mental awareness in pets as they get older. And of course, energy is a fundamental requirement of any tissue regeneration and repair. So definitely, I would give that alongside the PEA in that particular circumstance.
Thanks very much.
Brilliant. Fantastic. Thanks for coming along, and have a great weekend. Lovely to see so many of you as well again, by the way.
Thank you.
Bye.
Bye.